If you're suffering from knee pain or knee instability, it might be time to see your doctor. But how can you tell? How do you really know if the problem is a torn ligament? In this video, I'll at least help you try to figure out if you have maybe an ACL tear or some other type of knee ligament injury and help you decide whether or not it's time to see a doctor. My name's Dr. David Geier, orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. Imagine you're playing in a pickup basketball game and you jump to catch the ball. You land awkwardly and feel something pop. You figure it's just a strain and you try to keep playing in the game, but just minutes later, you can barely walk, let alone get off the court. Your knee is now swollen like the size of the basketball. You realize maybe this wasn't an ordinary sprain after all. Now, what causes a knee ligament injury? These are almost always caused by a specific outside force, meaning the ligament was injured not from normal activity or from overuse, but resulted from impact or some other trauma. Some of the things that cause that type of injury can be twisting your knee while changing directions, landing awkwardly from a jump, being hit by another player during a sporting event like football, a car accident. Some of the signs of a ligament injury are worth talking about. First, pain and swelling. Those are the most common symptoms of a torn ligament. A torn ACL may cause pain in the front of your knee or deep inside the knee, while a torn MCL hurts on the inside of your knee. You may notice swelling, which is normal even within the first 24 hours after the injury. In the case of an ACL tear, the knee swelling, which we call an effusion, may be very significant, a very large amount of swelling. If you've injured a ligament in your knee, there's a good chance it'll be painful to move, really get around at all, painful to bend, and really just do any of your normal activities the way you do. Another common symptom is that the knee might feel unstable. Maybe it feels like it's moving in ways that it shouldn't, such as giving way when you stand up, giving way when you walk. Maybe it's painful or it gives way when you try to move or twist in certain directions. Maybe it feels unstable when you're squatting, things like that. Now, there are a number of tests that can determine if you have a torn ligament. Most of those, though, are not things that you can do. That's why it can be really helpful to see a doctor, and specifically an orthopedic surgeon, maybe a physical therapist that can do those tests. Things like x-rays. Now, x-rays just show bones, which don't show the ligaments in the knee, but the x-rays can rule out other causes of the symptoms you're having, fractures, maybe dislocations, and certain x-ray findings can suggest a tear of a ligament even though you can't see the ligament itself on the x-rays. An MRI test or an MRI scan, magnetic resonance imaging scan, can determine damage to the specific ligaments and other soft tissues around and in the knee joint. Now, if you have pain and swelling or you notice instability of the knee, I would say it's important to go see a doctor as soon as possible. Again, pain is one of the most common symptoms of a torn ligament. If you have significant amount of swelling in the first few hours after the injury, that's a bad sign. Instability or feeling like your knee is giving out, feeling like it's loose or unstable compared to the other side, very important signs that you could have a knee ligament injury. If you do have a knee ligament tear in your knee, seek medical attention as soon as you can. Maybe consider seeing an orthopedic specialist who can do some of those, not just physical exam tests, but the x-rays and MRIs to determine if you have a torn ligament and help recommend treatments if you do. I'd love to hear about your experience with your knee injury. Leave those in the comments below. Just know, yes, I will read them, but I can't respond and offer you medical advice, but I'll try to answer your question in a future video. Also, please subscribe to my channel. Click the bell to be notified when I release a new video or start another live stream, including my Ask Dr. Geier live shows. I really appreciate you watching. I look forward to helping you feel, look, and perform better than ever.